Good evening. Welcome to our webinar tonight on reducing pain and avoiding surgery. I'm Russell Burgum. I'm the physician at Regenexx Des Moines, and I am a non-surgical orthopedic sports medicine physician practicing regenerative medicine at the Des Moines Clinic. Tonight we'll talk about interventional orthobiologics and what that entails and how treatments through the Regenexx protocol and Regenexx proprietary processing techniques can help you to avoid elective orthopedic surgery. So I mentioned interventional orthobiologics. What that refers to is using high resolution image guidance to direct injections or procedures into orthopedic musculoskeletal tissues. So what that means is using image guidance such as high resolution ultrasound or real-time X-ray called fluoroscopy to guide injections of patient's own cells into areas of tissue breakdown, such as arthritic joints, tendon injuries, ligament injuries, musculoskeletal injuries. The two slides I have up on the left, there is an image of an ultrasound procedure room, and on the right is what a fluoroscopy procedure room looks like. So I'm a Regenexx physician in the Des Moines Regenexx Clinic. In 2005, the Centennial Schultz Clinic in Colorado was the first clinic on earth to begin treating orthopedic conditions using precision-guided stem cell injections. This all represents a new medical specialty that I mentioned earlier called interventional orthobiologics. And so what is this? Well, the core tenets are that we use injectates to facilitate bone, tendon, ligament, muscle, or cartilage healing using precise placement of these injectates into damaged structures with image guidance. And we've developed new tools to facilitate percutaneous tissue manipulation, meaning percutaneous means through the skin and addressing the orthopedic tissues. So how does this relate to like other clinics where you go to, let's say, an orthopedic clinic or a sports medicine clinic and they do some type of injection? Well, the simplest would be simple injections that 95% of US physicians do. And that's basically just putting an injection, usually cortisone or a steroid, into a joint. These are, for the most part, non-guided, simple injections, just putting the injection into a joint. Now, roughly 4% of US physicians will use guidance. They'll use ultrasound or fluoroscopy to guide injections into tissues. And maybe 1% of US physicians follow what's called are part of what our new specialty of interventional orthobiologics is. And that specialty really has come into fruition probably in about the last 10 years. So the difference is when I see a patient for a knee issue, for example, if they have knee arthritis, I don't just put a single injection into the joint. What Regenexx physicians will do is do a full analysis of your biomechanics of the joints above and below the joint that's giving you a problem, and a full analysis of the structure of that joint. So, for example, an arthritic joint, the main issue is the wearing down of the cartilage inside the joint, but that contributing factors have a major role. For example, if the joint is unstable and the supporting structures around it are lax, the joint will wear down quicker. So, for example, on the picture that I first pulled up, showing the hip, instead of just injecting into the joint, I may inject into the lip of cartilage on the edge of the joint, into the ligaments around it, the hamstrings, the hip tendons, such as your gluteal tendons, the iliopsoas tendon. In a knee, there's numerous ligaments: the medial collateral ligament, the lateral collateral ligament, the patella tendon, the quadriceps tendon, hamstrings, the ACL, even the fascia layers. Fascia is the thin layer of connective tissue that surrounds muscles and tendons, and you can have issues causing pain in your fascia, and those would be also possibly injected. Or in the shoulder, there's numerous structures that I've outlined here on the shoulder. So that's why when oftentimes I'll see patients and they may have had a steroid injection elsewhere, and when I'm treating their knee, they'll be surprised to say, "Wow, you injected me 10 times in different areas," and that's because we address the whole functional unit. So we're very different from other stem cell clinics that you may see advertised. One, Regenexx clinics are, if you go to a Regenexx clinic such as ours, you will only be treated by a physician, and they're highly trained physicians who specialize in this area and also have had additional training on Regenexx special protocols for treatment of different joints, as well as Regenexx protocols for processing your own blood or bone marrow products. All injections are done with fluoroscopy or ultrasound guidance, or both. Your cells are processed in our own clean room lab right on site, not a simple bedside centrifuge. And this is backed by a multi-million-dollar lab and clinical research facility on site at the Denver clinic, where they also have a fellowship program to train physicians. And there are now actually more like 90 sites worldwide. And a big benefit of being treated at a Regenexx clinic is we have the world's largest orthopedics outcome database registry. And what that means is, before a patient has a procedure done, whether it's a very complex procedure or a fairly simple procedure, we ask all of our patients to fill out a questionnaire that has them try to enumerate their pain level and their functionality level, what the things you can do and cannot do. So we have a pain and function baseline survey that you fill out. After a procedure, you'll get similar surveys at 1 month, 3 months, 6 months, 12 months, 18 months. And starting at 2 years, you will be receiving similar surveys annually for up to 20 years. And we do this to track, to see what conditions are being treated, such as, is it a knee arthritis, or is it a ligament tear, or is it a shoulder injury, shoulder arthritis, shoulder rotator cuff tear. So we track what is being treated, what type of treatment are we providing? Are we using platelets from your blood, or bone marrow extract from the back of your pelvis, which includes stem cells in it? We track how effective was it and how long of a relief did you get. And we use that to try as a baseline for telling our patients, when a patient is being evaluated, to tell them, how good of a candidate are you for a procedure? Are you a good candidate, or a fair candidate, or a poor candidate? And the outcomes database is the baseline, or the main tool that we use to give you your rating of your candidacy. The other things that come into play into how good of a candidate you are revolve around your activity level. The more active the patients are, the better they heal, because these procedures that we do stimulate your own innate healing. So if your body is a good environment for healing, you are a better candidate for a procedure. Things that can increase your candidacy are your diet. Do you have a healthy diet that is rich in fruits and vegetables and anti-inflammatory foods such as fish oils and healthy nuts and healthy oils, or do you eat at McDonald's frequently? Highly processed foods, as well as foods with a high um, processed sugar content, are very pro-inflammatory, as are foreign proteins such as animal proteins. So highly inflammatory diets are things that make you a little less of a favorable candidate. And so a large part of a visit with me involves not only doing a thorough examination, which includes generally ultrasound examination of the area of concern, but a lot of counseling on how can you improve your diet, how can you improve your lifestyle before doing a procedure to improve the healing environment in your body to try to maximize your outcomes. We also spend a fair amount of time going over different dietary supplements that have been shown to decrease chronic inflammation or increase stem cell activity in your body. So it is a real holistic whole body approach that we use to really try to give you a good estimate of how good of a candidate you are for a procedure, and two, to try to improve that candidacy through dietary and lifestyle recommendations. So we perform precise image guided MSC, BMAC, and platelet procedures. So MSC stands for mesenchymal stem cell, and BMAC is bone marrow aspirate concentrate. And platelets are part of the blood, part of your blood that we can use, and that is called platelet-rich plasma. So we can treat issues from head to toe. Headaches are often caused from neck issues. You can treat upper back pain, shoulder issues, rotator cuff tears, arthritis, hand and wrist arthritis, carpal tunnel syndrome in the hands, low back pain, hip arthritis, hip labrum tears, knee arthritis, ACL tears, that's the anterior cruciate ligament, meniscus tears, ankle arthritis. So we really can treat things from head to toe. So I mentioned we have the world's largest outcomes database. As of today, this list shows the areas that are treated at Regenexx clinics across the country that are being tracked in the outcomes database. So the number one most common treated area is the knee, with 19,553 cases currently being tracked. Lumbar spine at almost 15,000, followed by shoulder, hip, cervical spine, foot and ankle, hand and wrist, and elbow conditions. So I mentioned interventional orthobiologics and what's involved. And so again, here are some pictures showing on the left a fluoroscopy procedure. So you see it's a surgical preparation, surgical drapes, surgical gowns employed, and that machine is a fluoroscopy machine imaging a patient's knee. And then on the right, there are two pictures. The top picture is a fluoroscopy picture, and the bottom is an MRI image of that same knee. So if you look at the MRI image, the area up here, this is the kneecap or the patella. This is the femur. This white area line here is joint fluid. That's about the normal amount of joint fluid. This, however, so on this MRI, normal healthy bone is dark. People can get areas of bone that are starting to break down or degrade inside the bone in any part of your body. And in this case, this is the patella, the kneecap, it is degrading inside. That's what this white is. It's called a bone marrow lesion. And that's important because areas with if you have bones that have bone marrow lesions, that's due to swelling and breakdown inside the bone. The cartilage underneath the kneecap or in any joint, the cartilage gets its nutrition mainly through the bone, through diffusion of nutrients through the bone, and also through the joint fluid, the synovial fluid. So when patients have areas of bone marrow edema like this, that actually inhibits the cartilage from getting nutrition. And so there is a procedure that we do, and I would guess that there are very, very few clinics and quote stem cell clinics around the country that offer this procedure, but the procedure that we do to treat those bone marrow lesions called intraosseous bone augmentation, meaning we can guide a needle called a trocar into the area where the bone marrow is, where the bone has the edema, and get it to heal by injecting platelet-rich plasma, or in most cases, we inject bone marrow concentrate. So on the above fluoroscopy picture, this shows a trocar going into the bone. We do these under IV anesthesia and sedation. You're awake, but we control the pain with IV anesthesia. And this little line here is a needle showing injection into the joint space. The dark area here is contrast dye. So it's showing that this is in the joint space. So that would be putting an injection in the joint space, and this would be putting it in the bone. So we also can inject the bands of the anterior cruciate ligament. You hear about athletes having ACL tears. Well, we can treat ACL tears under fluoroscopy, as well as treating tears. This is a shoulder image, fluoroscopy image, showing contrast dye in the joint, as well as contrast dye into the lip of cartilage called the labrum. We also can take platelets and concentrate the platelets into what's called platelet-rich plasma, and then process that even further to release all of the platelet growth factors called platelet lysate. And we use platelet lysate to provide nutrition and healing factors to nerves, such as the nerve that goes through the wrist in carpal tunnel syndrome called the median nerve, which this picture is showing an injectate around the median nerve, or nerves coming out of your back or your neck, or people can have impinged nerves in their ankle or in the shoulder. And so this is an ultrasound image looking kind of at a cross-section image of the wrist, meaning imagine if we had cut your through your wrist and we're looking at sort of the stump, and this shows the platelet lysate surrounding the median nerve. So why would you want to do a procedure like this, and why do we think, and well, we actually know we have the ability to replace elective orthopedic surgery. We have Regenexx clinics have been collecting this data for years, and as a result, we have enough data to show corporations that provide healthcare insurance to their employees, self-funded healthcare insurance. We have enough data to show them we can help you reduce insurance costs by avoiding elective orthopedic surgery, such as rotator cuff repair surgery or total knee replacement or hip replacement, by doing a Regenexx type procedure. And as a result, we now have over 2,000 corporations, or ranging from large corporations to small companies, who provide Regenexx only regenerative medicine treatments to their employees, because we've shown that we can reduce costs, and it's less invasive, patients get up and walk off the table. You can move around the day of a procedure. You have a quicker recovery. You're not laid up for weeks. You may have a little bit of a flare-up of pain for the first day or two, but your recovery is much quicker, and you keep your own body parts. You preserve your biomechanics. So when we're doing these different procedures, there are growth factors that we use. There are things called cytokines or stem cells, and growth factors are like, imagine them like espresso shots for local repair cells to kickstart your healing. And cytokines are natural chemical messengers that tell cells to do things or help clean up inflammatory chemicals in your body. And we get these growth factors and cytokines from platelets in your blood and also from your bone marrow, which has numerous healing cells as well as stem cells in them. And then stem cells, we like to think of them as like general contractors that direct all the other tissues in the area, direct them on the healing process, and coordinate healing in an area. And they also block pain signals and decrease inflammation in the area. And then at the end of the day, they can turn into the actual bricks and mortar. They can actually turn into new tissues. But their main function is signaling all the cells in the area and coordinating them to promote healing of your own cartilage or tendons or ligaments. So let's talk about platelet-rich plasma. So platelet-rich plasma is probably, well, depending on the Regenexx clinic and their area of focus, whether it be spine or shoulders or knees, platelet-rich plasma procedures comprise probably anywhere from half to 80% of the procedures that we do. So what that involves is platelets are a component of your blood. So to make platelet-rich plasma, we draw your blood through the vein, getting many vials of blood. Then we can separate out the layers of blood into the red cells, the white cells, and then the plasma layer, which is a sort of a clear yellow layer of your blood that comprises about 30 to 50% of your blood volume. And platelets live in the plasma. So if we separate out and get rid of the red cells and the white cells, and if we're left with the plasma, we then can take a large volume of plasma with platelets intermingled throughout the plasma, and then extract all the platelets, and then take all those platelets and reconstitute them in just a small volume of plasma. And that's how we increase the concentration of the platelets. So, and that becomes important because PRP by definition means you have taken blood and extracted the plasma and concentrated it to at least twice the normal concentration of platelets in your blood. And it's important because there is great research showing that that concentration makes a difference. The older we are, the higher the concentration you need to be effective. And the more damage or more degradation you have in the joints or tissues, the more platelets you need to put in that area. And that becomes an issue because there are places all around the country that say, yep, we do PRP injections. And unlike a Regenexx clinic, where we have our own lab and we can concentrate your platelets to whatever concentration I feel you need, which is usually somewhere between 10 times your normal blood concentration up to 20 times. These other clinics are dependent on using PRP processing kits from device manufacturers, and they're limited in that they can only provide basically one concentration. And that concentration in a really good PRP kit is going to be somewhere in the 6 to 7 times your normal concentration. And there are lots of kits out there that are 1.5 to 3 times your normal blood concentration. What does that mean? Well, the studies have shown that as you increase your age, you need a higher concentration. For young people under the age 30, the benefits seem to peak out at about 6 times your concentration. So if you had a really good processing kit and the patient was young, that would be sufficient. But if you're over age 30, which most of our patients are, those concentrations need to get up into the 10 to 20 times your normal concentration. So one thing that's a big thing is we can concentrate them very well. And we use PRP for more mild arthritis, for small tendon and ligament tears. Platelet lysate is, I mentioned that before, mentioned this before. So we take the platelets and we actually break the cell walls of the platelets in the lab to release all of their growth factors, and then inject that those growth factors. So it's you can kind of think of it as like an immediate release drug compared to an extended release drug. Regular PRP, the platelets will release their growth factors, their healing growth factors, over the course of 7 to 14 days. And in platelet lysate, those growth factors are available immediately. And as I mentioned before, we use this quite frequently to help nerve repair and to help to improve blood supply to the nerves, because nerves have little microvessels that they need to stay healthy. And in things like carpal tunnel syndrome, or where nerves are being pinched, part of the problem is their microvascular nerve blood supply is getting compressed and impaired. And one of the things that platelets can do when they release their growth factors is they can release growth factors that stimulate a new blood vessel formation. So there are numerous growth factors that are released when platelets are injected, and they get released when the platelets come in contact with connective tissue such as collagen. So these are all the growth factors, the main growth factors found when PRP is injected, which includes insulin-like growth factor, platelet-derived growth factor, vascular endothelial growth factor, connective tissue growth factor, which helps promote cartilage regeneration, and transforming growth factor beta, which signals stem cells to become more active and to help and to signal those stem cells to differentiate, which means stem cells are cells that haven't really decided what they want to be when they grow up. They haven't turned into their final cell type. So you have stem cells for cardiac tissue sitting in your heart, for example, or for muscles in your muscles, or stem cells for cartilage that can turn into cartilage around your joints. And TGF beta will stimulate those stem cells that are living in those areas to transform into their final product. So then we come to stem cell treatments. So we isolate and concentrate stem cells, or MSCs, and many other potent cells from bone marrow aspirate. That means using a syringe to draw bone marrow out of your own body, and then taking a fairly large volume of bone marrow and separating out all of the layers of the bone marrow and extracting the very small layers with all the potent cells. And these can help repair tissues, and we can, just like with platelets, we can concentrate these much better than other labs can do using simple bedside centrifuge. And so many people have a lot of anxiety regarding a bone marrow procedure, because they hear horror stories from family members or people in the community about, oh, I know so-and-so had cancer and had a bone marrow biopsy, and it was very painful. And that is not the case here. Well, I would say probably 95% of the patients will say that was really easy. I hardly felt anything. Part of it is we offer different types of sedation. One is IV sedation, where we can give pain medicines and a sedative through the IV. Another is we offer nitrous oxide gas, or laughing gas, in conjunction with like an oral pain medicine. And a big thing is our technique. So the pictures here on the left shows the actual parts of a bone marrow aspiration trocar. That's the term for the device that goes into the bone marrow. And in the middle, it shows a picture of the size, how big it is compared to average person's hand. And then on the right, it shows really what it's like getting the bone marrow out. There you can see a syringe there that's drawing up a red substance. That's what the bone marrow looks like, blood, like thick blood. And it's a completely sterile surgical technique. So the trocar, that's what this is, has a little insert that goes in the middle inside it. That's this. It's called the stylet over here, and it's got a sharp point. So when we do this procedure, one, it's a complete surgical prep. Two, I use ultrasound and guide anesthetic or numbing medicine from the skin all the way down to the surface of the bone. And on the surface of the bone is where you really have sensation. And then when we go into the bone marrow, one of the things that really helps to reduce the pain is I draw out just a little bit of bone marrow at a time, and then I advance and go a little deeper into the marrow cavity and draw a little bit more, and repeat that at numerous sites. And it's what patients will report as being painful is when the bone marrow is being drawn out, not so much going through the bone, but when you are sucking or aspirating the bone marrow out. And that's because it's a pressure change. And in most other clinics, what they will do is they will go into the bone in one spot and draw a large volume all at once fairly quickly. And that rapid pressure change is what causes pain. Whereas we do a very small amount at several depths, at 3 different depths at several locations along the bone. And we do it in that way because the Regenexx research labs in Colorado have found that we get the highest number of live cells when we take a small amount from 3 different depths at multiple locations along the bone. And that brings up the point is that every bone marrow type procedure that we do, we always count we have a cell counter in every Regenexx clinic. So we track how many live cells were obtained and used on your procedure, and that also goes into the registry. And patients are always surprised at how well they tolerated this procedure. Whenever I'm doing the procedure, either while I'm actively drawing the bone marrow out or after I've done a pull of some of the bone marrow, I always ask patients, tell me what you're feeling. And 95% will say, it's just kind of a weird feeling. So this shows some drawings. On the left, there's a drawing of a patient. This is the position you're in. You're lying on your stomach, and it shows we get it out of the iliac crest on the backside of your pelvis, or in this area or this area on the far right. So the bone has a dense, thin cortical outer layer, and inside is like a spongy matrix of bone. That's where the bone marrow is. And when I work the trocar through the bone, I can feel resistance, and then I feel it kind of give a little, and then I know I'm in the bone marrow. I do this by hand, and then once I'm in, we draw 5 ml of bone marrow. Then I advance it a little further, 1/2 centimeter, and draw 5 more, and go a little further and draw 5 more. And then I'll back out of the bone, but not all the way out through the skin, and then redirect to a new location nearby and repeat that process. So we do this because there are many different layers of cells that promote healing. We can get platelets. We can generate platelet-rich plasma from the bone marrow. There are different cell lines that promote healing, including progenitor cells or stem cells. So people often ask, well, why don't all these cells just go to the area of injury anyway? Because they're a part of our blood. Why aren't they going to heal my torn tendon or my torn cartilage? The MSCs are present all throughout our body. They're kind of waiting to be activated. And I mentioned before that platelets become activated when they're come into contact with collagen or connective tissue. So a classic example is you get a cut on your skin. you get a cut and our skin has a good blood supply and you bleed right away, platelets in the blood come into contact with that connective tissue or collagen and they become activated and they'll start the coagulation cascade, which stops the bleeding. Then the platelets organize and direct the formation of a scab and then new skin and eventually new blood vessels. So the problem is tendons, ligaments, and cartilage do not have a good blood supply like your skin or like muscles have. So the platelets have a hard time getting there. So that's why we take lots of platelets from your blood, concentrate them into very potent, highly concentrated PRP, and guide those and inject them directly where we need them. Similarly with the MSCs, the mesenchymal stem cells, as well as the numerous other cells from the bone marrow. So some of the things that we have great success with are knee conditions where patients are requiring knee replacement. We can help them avoid that. We treat rotator cuff tears, partial tears, full thickness tears that haven't been retracted away from their attachment site, knee ACL tears. We have the ability to help many patients with severe arthritis avoid knee replacement. Our outcomes database shows that even patients with severe knee arthritis are considered good candidates if we are doing a bone marrow stem cell procedure. This doesn't work by growing a new knee. It works by making the toxic environment in the knee, the inflammatory and degenerating environment in the knee healthier so your own body can heal. For more severe arthritis, our outcomes database would show that platelets aren't a good option. That you'd be considered a poor candidate for a platelet procedure, but for mild, even bordering moderate arthritis, platelet-rich plasma is a good option. We treat meniscus tears or arthritis from previous surgeries or previous steroid injections. Corticosteroids will help with pain relief and take away swelling. But unfortunately, steroids that are injected at the doses used routinely at all clinics around the country, except for Regenexx clinics in particular, but steroids are toxic to cartilage cells and toxic to tendon cells. And there are numerous publicized research studies showing cortisone injections in your joints accelerate your arthritis, accelerate the cartilage breakdown. They weaken your tendons like in your shoulder and the rotator cuff. And so our procedures can help treat degradation that may have been caused by previous steroid injections or from prior surgeries. In the past, and unfortunately, there are a number of surgeons that today still will say, we can go in and do arthroscopic surgery to clean up your arthritis in your knee or clean up that frayed meniscus. And it's been shown that those types of surgeries, really, they don't change your projected outcome. And they actually can, especially meniscus surgeries where they take out a large portion of your shock absorber meniscus tissue, those meniscus surgeries can make you can accelerate your arthritis because you're losing your own shock absorbers. So we're currently tracking almost 20,000 knee procedures going back as far as 2005. And patients rate their knee improvement by 38% at 1 month, 51% at 3 months, and 57% by a year, and 61% by 5 years. This is all from our outcomes database. Looking at their functional rating, so initially patients would say, my knee is about 56% functional initially on average. By 1 month, that increases to 66%, and by 1 year, it's up to 73%, and by 5 years, it's up to 76%. So I mentioned the bone augmentation procedure before. So that's an advanced treatment for moderately severe to severe arthritis, as well as for areas that have bone marrow lesions. So for example, you can have a bone marrow lesion, but still have mild arthritis, let's say in your hip or your knee. Those bone marrow lesions are worrisome precursors for rapidly advancing arthritis. So if we see a bone marrow lesion, the treatment of choice is to do the bone augmentation, injecting into that area of bone marrow edema, which is this white area here. Normal, healthy bone would be the dark area. So now in our Regenexx clinics, we have found that even if a patient does not have bone marrow lesions or bone marrow edema, but they have moderately severe to severe arthritis, in addition to doing our bone marrow stem cell type injections onto the surface of the joint, and we have found that by adding bone augmentation, where we inject bone marrow extract onto each side of the joint, into the bone here and into the bone here, that we get even better results. And so for the last 2 years, intraosseous, meaning into the bone augmentation is the standard of care in Regenexx clinics for patients with moderately severe to severe arthritis. And there have been numerous research studies showing the benefit of bone augmentation, how you can actually heal those bone lesions. Most of those studies were done by Dr. Philippe Hernigot in France, dating back 10 years. He's an orthopedic surgeon who also is very skilled at bone augmentation. So we use ultrasound guidance and fluoroscopy guidance, like I showed on the earlier slides, and IV conscious sedation, because this is more painful than taking the bone marrow out of the pelvis. There's a lot of pressure when I'm doing this injection, and so we use IV sedation for that for everyone. Oh, well, I take that back. I've had several patients who said, I don't want IV sedation. I even had a couple who said, don't give me any medicines whatsoever. But I've had many patients who have done this procedure and tolerated very well using nitrous oxide gas with some oral medication, like 1 or 2 pills of Vicodin an hour before the procedure. But in general, we use IV sedation. So these slides here, these pictures show what's involved with bone augmentation. So the tools are called intraosseous bone trocars. They're similar to what we use to draw the bone marrow out of the pelvis, but they're skinnier, they're narrower, and they're shorter. And this shows how we can do it into the knuckles of the thigh bone at the knee, called the femoral condyle. This is the tibia, the tibial plateau, and this shows in the hip. And this is a sample of one that we commonly use to do this procedure, called an Illinois bone trocar. So to take the 30,000-foot view, we're able to help many patients with ACL tears, other knee or ligament tears, knee arthritis. We treat ACL tears that are partial or full thickness tears that have not been retracted, but not retracted full thickness tears. Those our research has shown do not respond to even the stem cell procedure very well. So this is the same slide I showed earlier. It shows using fluoroscopy to inject into, there are 2 bands of the ACL, and we can inject into both of those with fluoroscopic guidance. So we're able to help many patients with moderate to severe shoulder arthritis, rotator cuff tears, shoulder labral tears. The labrum is a lip of cartilage that goes around the socket to increase the surface area of the socket. And that's something that patients often, if they don't see a Regenexx physician, end up having arthroscopic surgery for. So I want to address some of there's a lot of hype around stem cells and stem cell treatments. If you do a Google search on stem cells, you'll get hundreds of pages with people pitching books on regenerative medicine, treatments, IV treatments to treat your whole body, which there isn't really any good data to support that. IV treatments to treat dementia, stem cell treatments using amniotic tissue or cord blood, there's a lot of hype, and it's unfortunate because it can be a wild west, where people are not following scientific research studies or data, and that's what sets Regenexx apart. Is all our procedures are based on previously published research studies and based on our outcomes database tracking. So there's kind of three phases of how people or clinics or industries may adapt a new technology. And one is, hey, this is magic. It works great for everybody. And a more mature process would be, this is great, and it helps almost everybody, but there's some people that may not be a good candidate for this. And the Regenexx approach is, let's figure out who is a good candidate, and whether you're a good candidate or a fair candidate or a poor candidate. There are many patients who I've seen, and I'll say, your hip arthritis is severe. Our data shows that you have maybe a 1 in 3 chance of getting 9 months of relief with our most advanced treatment. I'd recommend you get your hip replaced. We've done the same thing for patients with really advanced ankle arthritis or severe shoulder arthritis. So we figure out who's a good candidate, and really look at the whole person to come up with that candidacy rating. So the biggest abuse that I see is the advertising for amniotic, placental, or cord stem cell injections, and I put that in quotes because there's been extensive research and numerous institutions, universities, the Regenexx research labs that have shown that these procedures have no live tissues in them. It's dead tissue with no viable cells. And if you think about it, if you're going to take cells from another person or the placenta or amniotic fluid, that has to be sterilized before you can ship it off and inject it into people all around the country. So when you sterilize those tissues, you kill the cells. Now, there are growth factors. I mentioned growth factors earlier. There are growth factors present in these products, but that's also been analyzed, and it's been found that there are more growth factors in your own blood. If you were to just draw blood out of a patient and just inject whole blood into their tendon or ligament, that there are more growth factors just in your blood than there are in these amniotic products. And so these are regulated by the FDA because it is considered a drug, and they're regulated as dead tissue products. So if you're seeing advertisements for that or a clinic saying, hey, we can do this for you, I would turn around and walk away. So that's what those are the topics I wanted to cover today. So we have time for some questions. If you have any questions, or you can type it in the Q&A section, or you can even pipe up and say it out loud. But if you don't have questions, I can hold on. I lost my screen. I want to put up contact information. So again, my name is Russell Burgum. I'm a doctor of osteopathic medicine. RMSK refers to a registered in musculoskeletal ultrasound. That's a board certification that I've obtained, and I am board certified in sports medicine. That means CAQ-SM is certified added qualification. So that was a fellowship training after residency. So we're located in Des Moines on Thornton Avenue. The telephone number is listed there, and I'd encourage you to go to the website regenexxdesmoines.com. On the website, you have access to numerous patient informational areas. Our Regenexx outcomes database registry data is available to the public. You should be able to pull that up from any Regenexx website. And there's links to videos, educational videos. Dr. Chris Centeno is one of the two founding doctors of Regenexx and is our chief medical officer. And he has a blog that he publishes pretty much daily that addresses different regenerative medicine questions or issues. And I strongly encourage you um, to sign up for his blog. Um, and 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 if you have any questions, or if you would like to be evaluated in our clinic, if you go to the Regenexx Des Moines website, there is a section there where you can fill out your contact information, and our education team will contact you and ask a number of questions about, like, what sorts of treatments have you had, where do you live, have you had any imaging studies, and they will facilitate getting you in for an evaluation. So, which brings up a point when you're seen in our clinic, and really at any Regenexx clinic, we it's not just a 15-minute visit or a 10-minute visit that you might get at an orthopedic surgery office. We you're going to spend maybe an hour and a half with me. I do a thorough examination, not just of the joint that's bothering you, but levels above and below. Patients can have more than one issue to be addressed. And I mentioned how we spend a lot of time talking about lifestyle changes and dietary changes and things you can do to maximize your outcomes. And then after that visit, we also have time with our patient care coordinator, and who provides more additional educational information. So it's a very thorough evaluation, um, uh, and and we pride ourselves in taking time to answer your questions and to do a very thorough physical exam. So if there are no other questions or concerns, um, I will sign off, and thank you very much for your attention, and have a great day.